Hi, ladies and gentlemen. It's been some time since I have come online. Okay, so now today I'm going to give you all an introduction on my subspecialty, that is urogynecology. Okay, let me just share the screen. Okay. Okay, I am Dr. Anil. I'm a consultant obstetrician, gynecologist, and urogynecologist at Bagan Specialist Center, Batuan. So today I want to give you just a brief introduction on urogynecology. So this is where I practice, Bagan Specialist Center, which is one of the private hospitals in Batuan, Penang. So a bit of a self-introduction. I was born in Penang. I did my schooling in Batuan. My hometown is Batuan. Studied in Manipal, graduated in 1998. I started working in the Ministry of Health since 1998. Did my housemanship in Ipoh. And then from there, I went out to specialize as a gynecologist, obstetrician and gynecologist. Graduated in 2007, and in 2010, I started my subspecialty training, fellowship in urogynecology. And then I was gazetted as a urogynecologist by Ministry of Health in 2013. So it's been around 8 years. I was in Ministry of Health for 16 years. And in 2014, I left for private practice. And ever since then, I've been in private practice. So obstetrics and gynecology is basically a specialized field in managing women, basically managing pregnancy, disorders of pregnancy, and also all the disorders of women reproductive system, that is the uterus, the tubes, and the ovaries. And although obstetrics and gynecology already a very specialized field, we have subspecialties. Okay, there are 5 subspecialties, and urogynecology is one of them. So this before I explain about urogynecology, I want to explain about my specialty training. Okay, so this urogynecology is a fellowship program. It is by the Ministry of Health. It is a 3 years program. So what we do is 3 months of urology, basic urology, 3 months of colorectal, and then 6 months there is training under urogynecologist recognized by the Ministry of Health, and 1 year we go overseas. Okay, so for me, I was in Taiwan for 1 year, trained under a very prestigious person at a prestigious center in Taiwan. And then after coming back, I had to undergo 1 year more training in Ministry of Health, which was also in which I did in Penang GH, and I was gazetted after that. So after 3 years, you undergo an interview, and then you'll be gazetted as a urogynecologist. So at the moment in Malaysia, there are only around 25 urogynecologists. So we are not many urogynecologists in Malaysia for a population of like 32 million. So symptoms, so what do we do? So we manage, if you have these symptoms, if you feel like something coming down when you strain, or do you feel like leakage of urine when you cough, sneeze, or laugh, or you cannot control your urine. Some people, they cannot control their urine. Or some people, after delivering few children, they feel loose. They don't feel satisfied when they're having intercourse with the partners. These are the things we deal with. So what we do is we make women feel wonderful again. Okay. So introduction, as a urogynecologist, what we manage is basically prolapse of the uterus, prolapse of the bladder, and also prolapse of the rectum through the vagina. Okay, these are the symptoms you get. Prolapse, you feel like something coming down, or something you feel a lump in the vagina. These are all symptoms of prolapse. And then urinary problems, like stress incontinence, when you cough, sneeze, or you have urgency, that means you cannot control urine. When you want to pass urine, you have to go quickly. And other female urinary problems. And also we manage female sexual disorders. Okay, we do some vaginal rejuvenation and also some cosmetic gynecology. Some people do some cosmetic gynecology. So what I'm going to do is, this is just an introduction. So what I'm going to do is, I'm going to give a series of talks. Okay. So first about prolapse. First I will introduce about prolapse, pelvic organ prolapse, and then the management of prolapse. And then after that, I'll talk about counseling, pre-operative counseling, what we have to explain to the patients before we do any surgery, and also the types of surgeries for prolapse. And after we talk about prolapse, we talk about urine problems, urinary incontinence. What is stress incontinence? What is overactive bladder? What are the causes? How we manage? And after that, we will talk about genitourinary syndrome of menopause. These are all those ladies who are menopause. Problems with those ladies who are menopause. And another common thing I'm going to talk about is urinary tract infection. And also last, cosmetic gynecology. This one, a lot of ladies will be interested. So introduction, this is the ladies' female pelvis. You can see your pelvic organs. This is the uterus, this is the vagina, this is the tube, ovary, urine bladder, and the rectum. Okay, so when prolapse is when the uterus comes down, bladder comes down. This is an extreme of prolapse. Okay, this is all just an introduction. So the main thing is why I am doing this, why I want to do all this is because I want to create awareness. We are all still at the awareness stage. Many people, many ladies suffer from these problems. Okay, urine coming, cough, urine come out, the prolapse and all that. But unfortunately, many people don't know where to go, don't know where to seek help also. Don't know how serious the problem is. Actually, it is just a quality of life problem. It's not a matter of life and death. These problems are all basically a quality of life problem. So many people also assume it's just due to old age. Okay, but even nowadays, there are more and more people living longer life. So why not live a better life? Okay, although we can improve the quality of life. And then a lot of people are shy. A lot of ladies are shy. Okay, because also assume due to old age, they think no one will bother about them. They are shy to come out, and this can cause a lot of other problems like decrease in self-confidence, and it can end up in depression. And many do not know there's treatment also. We can treat all these conditions. So my aim is to create awareness and to educate ladies about all these problems, and also to share with them the treatment available. Okay. So we have our international societies. There's the International Continence Society. These people, they deal with all the continence problem like urine continence, bowel incontinence. Okay. Then we have our International Urogynaecology Association. Okay. And we have our own society, the Malaysian Urogynaecology Society. We are affiliated to the International Urogynaecology Society. This is a very small society, our society, the Urogynaecology Society, but we meet every year and we have our regular meetings and discussion among our small group. So now that is about the introduction to Urogynaecology and all the about our training. So for more info, okay, you can go to my Facebook page. Okay, this is my Facebook page. Please like, please share. And tonight, first, I will go to start with pelvic organ prolapse. This is the main thing we do, prolapse. Although I given talks a few times, but looks like a lot of people still not very sure, don't know whom to approach, don't know where to go, don't know what is the treatment is all about. So I will give another talk on this. So please share, please today at 9:30 p.m. I'll give a talk on pelvic organ prolapse. Okay, thank you very much. Thank you for listening. Please share. So hope to see you all tonight. Thank you.